I really hope you all are doing good. Bringing another most requested topic. In this quick video, I'm going to talk about Q angle. Q angle basically tells us about the net pull of quadricep muscles on the patella. Therefore, we can say that Q angle tells us about the resultant pull of quadriceps with respect to patellar tendon. Q angle is the angle made by first line that is drawn from ASIS to the midpoint of patella, and another one from tibial tuberosity to midpoint of patella. Normal value 10 to 15 degree. Now let's see what are the implications of that. So as we know, Q angle is telling us about the net force quadricep muscle is exerting on the patella. So the very first and direct implication of Q angle is lateral forces. Any increase in Q angle could potentially increase the lateral forces on the patella. Therefore, we can say that any increase or any factor that increases the angle Q angle, that can increase the forces on the lateral aspect of the knee. And if these forces increases significantly, could result in lateral displacement of the patella. If you always had trouble remembering the Q angle concept and the implication, I'm going to tell you a very simple logic here which will help you to remember this forever. I believe so, at least. So think of Q angle as the overall quadricep muscle pull. Let's first look at the first aspect of quadricep muscle, the rectus femoris. This muscle originates from the ilium and covers a large aspect of the knee, middle to lateral side. This muscle also almost covers other three muscles that are part of quadricep muscles. So basically, the rectus femoris is on the top of other three quad muscles. Now, to add to this, vastus lateralis is also situated more on the lateral aspect of the thigh. Whereas, on the other hand, vastus medialis is alone on the medial aspect of the thigh. The last one, but not the least, is situated right in the middle of these two, vastus intermedius. Now, if we have to look for the logic, I think it's already pretty clear that the major force production is coming from the lateral aspect. Therefore, we can say that the estimated line of pull of the quadricep muscle lies somewhere on the line that we just drew from ASIS to the midpoint of the patella. Here we go, that's all we need to remember. Now you know why we drew the line from ASIS to midpoint of the patella. The only thing you need to keep in mind for your clinical practice is, in the case of substantial imbalance between the medial and lateral aspect of quadricep muscles, this line of pull could change, thereby changing the whole concept of Q angle. But we don't really have to worry about it here because that's not an entry-level question. All you need to know is the basic. Let's quickly talk about a few scenarios where we can find any increase or decrease in the Q angle. Let's start with a very simple one first. In the previous video, I talked about anteversion. Now you remember that in the anteversion, femoral, the whole femur turns medially, or it rotates or torsions medially. If this huge bone, the femur bone, is torsioned towards the inside of the thigh, it will definitely carry the small little patella along with it. Now, what do you think about it? Since the center of patella has also moved with the patella in the anteversion case as the femur rotated medially, it's definitely gonna change the Q angle. And I guess most of you have guessed it right. It's gonna increase the Q angle. And any increase in Q angle implies that the lateral forces on the patella could increase. Second scenario is genu valgum. So now, as you all can picture that in genu valgum, the obliquity of the femur bone changes and it shifts more towards the medial side. And again, we can say the Q angle will increase in this scenario as well. And the third scenario, and the last one as well, what's gonna happen in the case of tight IT band? Well, it's gonna pull the patella towards the lateral side. This could increase the lateral stress on the patella. This whole scenario can lead to patellofemoral pain syndrome because the patella is now laterally situated, and during flexion and extension, it doesn't get to its original spot. And if you're aware of the inside of the patellar structure, and if that keeps rubbing against the lateral condyle of the femur, could lead to pain. Another quick example, prolonged or excessive foot pronation can also lead to medial rotation of the tibia. And now guess what? Again, patella would be medially shifted, and that will result in increase in the Q angle, and that implies increased lateral forces. So now, if you encounter a situation where you see that patient is complaining of pain on the lateral aspect of the knee, you can easily guess that that could be because increase in the Q angle, and what all situations can lead to increase in Q angle. For example, anteversion of the femur. Last part of this presentation is about how we measure it. Q angle is measured either in full extension or slight flexion. And I'm sure you want to know why. Let me tell you first why not. So why won't we use flexion position? In flexion, patella sit comfortably within the femoral sulcus. Do you think a patella can dislocate in this position? No. So it doesn't matter how high the lateral forces gets. If patella is sitting safely in the femoral condyles, it's not gonna dislocate. And coming back to the point that Q angle represents the lateral forces on the patella, and we wanna know the severity of it because it could lead to lateral displacement of the patella. We definitely need to pick a position where lateral patellar forces do matter. And that is either the extension or slight flexion, where the lateral forces on the patella could be most severe or more problematic than in the flexion.